Welcome to the Deep Dive. We're tackling breast fibroadenomas today, something you might well encounter in your revision notes.
Absolutely, it's a common topic.
And our mission, as always, is to pull out the essential facts from those notes, make them memorable, make them stick for revision.
Let's do it. So, starting with the basics. What is a breast fibroadenoma?
Okay.
Well, simply put, it's a benign breast tumor, non-cancerous. It's made up of both glandular and fibrous tissue.
Benign, glandular and fibrous, and the key feel.
Key characteristics are that it feels well-defined. You can feel the edges, and it's typically mobile. It moves easily within the breast tissue.
Right, mobile. Any tips for remembering that?
I like to think of it as a friendly, firm, and freely mobile lump. Captures the key features.
Friendly, firm, freely mobile.
Nice.
Okay, so causes the etiology. What's driving these?
Yeah, the exact trigger isn't definitively known, but hormones, specifically estrogen and progesterone, are strongly suspected to be involved.
Which explains the timing.
Exactly. It fits with why they're much more common in women during their reproductive years when those hormones are fluctuating more.
Makes sense. So who's most likely to get them? The risk factors.
Well, obviously being female is the main one. Age is another, typically women in their 20s and 30s.
Okay.
And sometimes a family history of fibroadenomas or even breast cancer can slightly increase the risk.
Got it. And down at the tissue level, the pathophysiology, what's actually happening?
It's essentially an overgrowth, like a localized proliferation of that normal glandular and fibrous tissue.
An overgrowth.
Yeah. And as we mentioned with the hormones, changes in hormone levels can sometimes affect the size, maybe make them a bit tender,
Right. So if you find a lump, it might be a fibroadenoma, but what else needs to be on the radar? The differential diagnosis.
Good point. We need to consider other things. Breast cysts are common, especially simple cysts, which are just fluid-filled sacs.
Okay.
In older women particularly, ruling out breast cancer is always crucial, even though fibroadenomas are benign. And there's a rarer thing called a Phyllodes tumor. They can sometimes seem similar initially, but are biologically different, can grow larger, and need different management.
Important distinctions. How common are fibroadenomas here in the UK? What's the epidemiology look like?
Oh, they're very common. Actually, they account for something like half of all breast lumps found in women under 35.
Wow, half?
Yeah. And overall, maybe around 12% of all diagnosed breast masses turn out to be fibroadenomas, so pretty frequent.
Okay, so quite common indeed.
Yeah.
How do they usually present the clinical features?
Typically, someone feels a lump. It's usually painless, feels smooth, maybe a bit rubbery.
Mm-hmm.
And it's well-defined, those clear edges we mentioned, and mobile. Remember our friendly, firm, freely mobile lump?
Back to the mnemonic.
Exactly. Size can vary quite a bit, too.
Okay, so the lump is found. What's the next step? How do doctors investigate and confirm it?
It starts with the basics.
Okay.
A good clinical breast examination and taking a history. Then imaging is usually needed. That might be an ultrasound, which is often preferred in younger women, or a mammogram, especially if the woman is older.
Ultrasound or a mammogram. And if it's still not clear?
If there's any doubt, or sometimes just for confirmation, a biopsy is done. This could be a fine needle aspiration, FNA, or more commonly now, a core needle biopsy to get a small tissue sample.
To get that definitive tissue diagnosis. Makes sense. How are they generally managed in the UK?
Well, for many, especially if they're small and not causing any symptoms, the approach is often just observation.
So watch and wait.
Yeah, watch and wait with regular follow-up checks, maybe repeat ultrasounds. But if the fibroadenoma is large or growing or causing symptoms like pain, or if there's any diagnostic uncertainty, then removal might be advised.
And how is removal done?
Surgical excision is the traditional way, but there are also minimally invasive techniques now, like cryoablation, freezing the tissue, or vacuum-assisted removal.
Okay, good to know their options. What's the general outlook, the prognosis?
Excellent, really. That's the main takeaway. These are benign,
Not cancer.
not cancer, and they don't increase your future risk of developing breast cancer. Once removed, they rarely come back.
That's very reassuring. Are there any potential downsides or complications?
Well, the main thing is often just the anxiety and worry that finding any lump can cause,
Understandable.
Occasionally, they might cause some pain, perhaps related to hormonal changes or if they grow quickly, but that's not typical. And of course, if surgery is done, there are the standard surgical risks like infection or scarring.
Right. So wrapping up the key points. Breast fibroadenoma is benign, very common, usually straightforward to manage.
Exactly. Knowing about common conditions like this just empowers you, helps you feel more informed about health.
Totally agree. And if you want more targeted MSRA revision resources, definitely check out pastmsra.com and also freemsra.com.
Great resources.
Thanks for joining us for this deep dive.